Alright, so we're going to be doing the overhead squat assessment along with some corrective exercises. So we're going to be identifying our impairment and applying an intervention and then looking for an outcome. So overhead squat assessment is a great tool that we can use to kind of get a full body motion assessment. So what you're going to do is you're going to have your patient have like a dowel. We just using a cane here. So to measure where you want the cane, you have them set it on their head, and then we look for 90-degree angles in the arms right there. So that looks pretty good. And then they're going to raise it up over their head, and we want the feet to be pointing straight ahead and about hip to shoulder width, so maybe just a little bit wider. And that looks pretty good there. And then we're going to watch 5 reps from the front, 5 reps from the side, and 5 reps from the back. So go ahead, we can do 5 reps. Okay, so we got a little toning out going on, a little bit forward leaning. Good. Let's do one more from the front. Good. And then we'll return to the side. We'll do 5. He's actually pretty good at this exercise. Maybe a little bit of forward leaning, and she's a little bit lacking in her thoracic extension. Hip mobility is really good. Dorsiflexion is pretty decent. She does toe out a little bit, so turn it there. And then you definitely have kind of that flattening going on, flattening out of the lumbar spine. Okay, good. So the 2 big things that I saw from that one were the lack of dorsiflexion and then the forward leaning of the trunk. So Katie has already told me previously that she's had some issues with her thoracic extension, and that was kind of what we saw with a little bit of the forward leaning in the trunk, especially from that lateral view. So as far as interventions go, we want to stretch the overactive muscles and strengthen the underactive muscles. So as far as stretching goes, we can look at maybe overactive pec major, pec minor, which is pretty common for a student who's going to be in that slouched over posture a lot. Maybe even overactive latissimus dorsi. And the other big thing, which is what we're going to demonstrate, would be you want to strengthen the weak muscles or the inhibited muscles. So we're looking at middle trap, lower trap, and rhomboid. So I'm going to show 2 exercises. These are the 2 best exercises that promote activation of the middle and the lower trap, while at the same time inhibiting the upper trap and those pec muscles. So we're going to come to the treatment table here. Right there. And I just have a 5-pound dumbbell. So the first exercise that we're going to do, you're going to go ahead and lay on your stomach. Good. And this is just it's called the prone extension exercise. So come move a little bit toward the side of the table here. You put this dumbbell in your hand. And then what you're going to do is you're just going to extend back. Just like that. So keep that arm straight. And really think about squeezing this guy back. But you don't have to come so far down. Right there, and stop right about there. Good. And hold that at the top. So that's one exercise. That's just prone extension. The next one is prone horizontal abduction with external rotation. So she's already in the right position to do this. Her arm is hanging off the table there. Perfect. We're just going to externally rotate, and then she's going to think about squeezing that shoulder back to the middle, and then she's just going to, we're going at that. Okay. And a little slower. Hold the top, and then come back to the good. And so we can progress these exercises by increasing the weight and reps as she gets better at them, and then continue to do inhibition techniques such as stretching, massage on those tight pecs and tight minor.